What we once believed was the key to good health may now be a potential death sentence. Emerging studies are reshaping how we should view antioxidants, most especially if you are battling with cancer. Shockingly, 5 popular antioxidant supplements have been found to secretly fuel the growth of cancer cells, putting your recovery at serious risk. And the bad part is almost every cancer patient are taking these antioxidants. So today in this video, we're going to look at the 5 antioxidants you should avoid if you have cancer, if you are battling with cancer. Now, number 1 is NAC, which stands for N-acetylcysteine. Having excessive free radicals and reactive oxygen species can actually cause damage to your DNA and induce chemical processes in the body that may increase your risk of developing cancer. So in this context, taking antioxidants like N-acetylcysteine may be beneficial, but sadly, multiple large randomized placebo clinical trials among cancer patients failed to substantiate this idea. In a study done in mice, NAC supplementation was found to promote the progression of certain pre-existing cancer, including lung cancer, liver cancer, and skin cancer. One concerning mechanism that was discovered is that NAC stabilizes BAC1. BAC1 is a transcriptional factor that represses the expression of antioxidant gene. Now, I don't want to get into details, but this stabilization of BAC1 actually leads to the upregulation of gene associated with cancer metastasis, potentially fueling the growth of pre-existing cancer. So if you have cancer like lung cancer, skin cancer, as well as liver cancer, I will actually suggest you avoid taking these antioxidants N-acetylcysteine, also called NAC. Number 2 is vitamin E. Several studies have raised concern about the safety of vitamin E supplements. Now, in a study done in animal, vitamin E supplementation was actually found to accelerate the growth of lung tumor through BAC1 stabilization, just like N-acetylcysteine. Now, in a study, both vitamin E and N-acetylcysteine was actually found to essentially eliminate the expression of the gene P53, which is often called the guardian of genome. In other words, this gene is the guardian of all your genetic information, all your DNA. Okay, so P53 is a tumor suppressor gene that is typically activated when DNA is damaged. Now imagine what could happen when this gene is not expressed when you are taking vitamin E and N-acetylcysteine. That is going to result in a lot of issues. Alright, number 3 is beta-carotene, also called vitamin A. Beta-carotene has long been promoted as a very powerful antioxidant, most especially for eye health. But when it comes to cancer, most especially lung cancer, it actually takes a darker tone. Some studies reveal that high dose of beta-carotene supplement can actually increase the risk of lung cancer, especially for smokers or those with a history of smoking. So while beta-carotene can be beneficial for your eye health, it also can be dangerous, especially if you have cancer. Okay. Now, number 4 is vitamin C. Now, vitamin C is one of the most popular antioxidants you could ever find. Most people take it without prescription. They take it for sore throat, they take it for cold remedy, they take it for other problems. But the problem is that excessive intake of this vitamin C, like in mega doses, it can actually reduce the effectiveness of chemotherapy treatment. So while you might be thinking that you are taking vitamin C is going to help fight against free radicals and oxidation or help lower your risk of cancer, it is actually complicating the whole issue because you are already diagnosed with cancer. So taking this antioxidant is going to help fuel their growth and proliferation. So you have to avoid vitamin C, most especially in mega doses. And lastly, several studies have shown that selenium has cancer-promoting effects. For example, the Nutritional Prevention of Cancer trial actually take a closer look at these supplements. So this study involved over 1,000 people who had previously experienced non-melanoma skin cancer. So these people were given 200 micrograms of selenium daily in the form of selenized yeast to see if it could prevent a reoccurrence. Now, the result actually showed no significant reduction in basal cell carcinoma, but what's shocking is that there was a 25% increase of squamous cancer cell and a 70% increased risk of total non-melanoma skin cancer. Now, selenium has also been found to promote the growth of prostate cancer. So if you have prostate cancer, I will actually advise you stop taking selenium. Okay, those selenium can be beneficial for the prostate, but taking the antioxidant form, the isolated form, might actually worsen the whole thing for you. Okay, so guys, these are the 5 antioxidant supplements you must avoid if you have cancer, if you've been diagnosed with cancer, or if you are on chemotherapy. All right, I've actually made a video where I talked about the most anti-cancer food. Definitely check it out.